In the last 1 year, we've been dealing with, it's actually close to a year and a half, COVID-19, not only in Kenya but also globally. How has this changed the space where we'd talk about HIV prevention, HIV treatment and management?
The last 18 months for people living with HIV has been a little bit rocky because first of all COVID came, and then they said everybody who is virally compromised, or the viral load is compromised, has a chance of getting COVID and probably dying. People living with HIV fell in this exact category. And which actually worries me, that people living with HIV are not a priority in the vaccine process in Kenya. It actually worries me. So when that came up, and then people were told stay home and social distance, and now the issue of psychosocial support was affected. Yes, at the beginning there was the multi-month drug dispensing and medication was there, but then the psychosocial aspect was not really catered for, because, and then most people were afraid of going to hospitals because hospitals were marked as red zones, so you're not able to go there, you're afraid you'll get COVID. So people defaulted from the drugs, a lot of them, and most of them, when they were called and followed up, they had good reason. So even the social worker is not able to actually accuse them of defaulting, because ideally this person makes sense. And then came in the issue of lack of loss of income. A lot of people lost income, and now they had to stay home. They don't have food. The nutritional support was a challenge, and it took very many months before even organizations stepped in to actually be able to provide those food care baskets. It took a very long time. So by that time, a lot of people had really struggled, and somebody asks you, why would I have to take ARVs on an empty stomach? It does not make sense. So they just stop altogether.
So with the COVID situation, we'd had the lack of the human touch, that human interaction, where most of the support groups rely on that for persons living with HIV. What else would you say was another challenge during this time?
Another challenge faced, of course, is the lack of the stockouts that happened, the ARV stockouts, and people are even given 2-week dosages. And of course, you know, that is dramatic, because somebody is now afraid. I'm coming from a 6-month dose to a 2-week dose, which means that if I travel, there were 2 aspects. Most people don't take medication from their own counties because of the stigma related to HIV. So, for example, if I'm living in Kisumu, taking my medication from Kakamega, and now I have to go there to Kakamega after every 2 weeks. You see, it does not really make sense. And there's the economic impact, where I probably don't have a stable income with the pandemic, because that has actually been brought out. And we now have that as an issue. And now the multi-month drug dispensing that we had started very well, and then the stockouts took us back to square one again. So we have had, like, I feel COVID-19 came to expose some of the gaps that we have in the HIV response. Mother-to-child infections. These mothers are afraid of going to deliver in hospitals. So ideally they decide to deliver from home. How safe is it for them? And how trained are the midwives? How trained are they? Should we train midwives to actually be able to help mothers give birth at home? Mothers who are probably shy or who have reservations in going to hospital. I feel it's time we start holding such kind of conversations, because they might ideally be able to stop mother-to-child infections, especially during birth. So some of these conversations that we left behind, and now children came back home from school. They were home for a very long time. Some of these children are living with HIV. And some of these children are in homes that are not mentally stable, I can say that. So how did these children cope? Because it's like we forgot about them. we forgot that we have children living with HIV, and we forgot that they also have challenges. You know, children in school, sometimes I feel like children when they're in school, they are happier.
Yeah, they are safer spaces.
It's more of a safe space than home.
Yeah.
And now they are home, they're taking the medication. Are we even following up to know that they took the medication on that particular day? So, and most of them don't even know why they're taking that medication because their parents have not reached the point of disclosing to them. We had the issue of privacy when it comes to people living with HIV and taking the medication. Most of them were afraid of taking the medication because somebody sees you disappearing at 9 p.m. and they're wondering, okay, what does this one go to do? People sent me photos of drugs, the bottle, and at some point I stopped posting my bottles of ARVs online because somebody actually told me, Doreen, the more you post, the more people see these drugs in our bags, and then they know it's official, I'm living with HIV, and maybe this is a person I don't want to know that they're living with HIV. So I felt like I exposed people to discrimination unknowingly, yeah. And I kind of felt bad, so I stopped. So the mental health of people living with HIV was not exactly well taken care of. We insisted on them being safe, but if you're safe and your mind is not safe, then it does not really make sense.
Okay. Let's talk about what do we need to do as a country. What are some of those take-homes that you would suggest as an advocate that you would say we need to put our acts together to manage this national conversation on HIV/AIDS?
HIV has been in Kenya for I think 37 or 38 years now, and in the world 40 years. But 40 years later, there are people who cannot even say they have HIV. Like they can't even say, not even to themselves they can't say that, which actually fuels the self-stigma. So we need to normalize the HIV conversation. I know it is probably, the stigma is mostly fueled because of the sexual aspect, but then again, if we keep being shy, we might go another 40 years while trying to still continue hiding like this. Yeah. So when will that time come when we are being able to be an honest country to ourselves and to the community at large? Because HIV is not ideally just for the people living with HIV themselves. It also affects people who are not living with HIV. So bring in the general population, bring in people living with HIV, have this conversation as a normal thing, because we have had conversations about COVID for the last 1 year. When it came, people were even afraid to cough in front of other people. The stigma was very real. I once coughed in a matatu and everybody looked at me like, okay, she has COVID, you see? But with time, it's like we've even forgotten that is where we were last year. Why are we not there with HIV? Because I know even if we say it's the sexual aspect, there are also other ways of getting HIV. Why are we not even talking about them? Because ideally our minds will always go straight to sex. So normalize the HIV conversation, because some countries, South Africa and Botswana, are doing very well in normalizing the HIV conversation. So I feel it is time we actually normalize that. And I know this does not affect the whole of Kenya, because the counties with the highest prevalence have actually managed to normalize the HIV conversation, probably because they're highly affected, but also how have they reached there, and what can they teach these other counties that have not yet reached that point of even accepting that there is HIV in their county, because there are those people who are at that level. So maybe they can give us a few best practices so that we ensure that where we are going, we are educating people about HIV. We are ensuring everybody is well informed. People know the treatment they're taking, because there are people who don't even know the treatment they're taking. And by doing that, I know we can at least manage the stigma. We have new products coming in, but we are not educating the masses about the new product. So the research keeps happening, things keep coming in, but we talk about it for a while and then we just leave it. So it's time we tell the whole population, and right from school, because I believe the best part to start is from school, because these kids will grow up with all this information and they will be better individuals by the time they are grown-ups. But for the general population, it's basically the civic education, I can say, so that at least they reach a point where they realize people living with HIV are normal people. And people living with HIV themselves reach a point and say, everything is fine, I'm taking my medication, I'm okay. Because my father used to live in Botswana, and he was very surprised that people take medication in front of you without even caring that they're taking medication. Yeah. Somebody tells you, come, take me to the clinic and then we can come back and do whatever we were doing. Like, it's so easy. Why is it not so easy in Kenya? So the political goodwill, maybe we can start by political goodwill, that will ensure that the HIV conversation is normalized in this country.
Thank you. As Doreen has rightly said, talking about HIV need not be a discussion that we reserve for boardrooms. It's not a discussion that we reserve for the barazas. It's a conversation that we need to have every day. It's a conversation we need to have at home, in school, in the community, and as a country. So let us normalize the discussion on HIV and AIDS. Thank you for watching Wanja's Health Diary.